Thanks, Mia. I'm so excited to be back.
Well, let's get right into it. So we'll talk about the importance of having pelvic floor therapy after birth, later in our conversation here. But I'd like to start with understanding who else could benefit from having pelvic floor therapy. Like, is there a good age to start thinking about incorporating it, into your health and wellness planning? Is it important to see someone regardless of whether or not you have a specific issue, or is there benefit to just having a sort of general proactive approach to pelvic floor health?
Yeah, it's great. And I think that the answer to this has really evolved over the years. I think we used to see folks coming in only if they had an issue, and those issues can arise early on, even for pediatric patients who have constipation, or when someone starts their menstrual cycle, if they have painful periods or difficulty inserting a tampon, even into becoming sexually active and having pain with intercourse. And even then into the later stages of life when someone goes through menopause and has hormonal changes that could lead to leakage or prolapse, or even male bodies that have prostate issues. So we've historically seen people come in at different ends of the spectrum of the lifespan, but then also obviously in between for pregnancy, postpartum, urinary leakage related issues. What I really start getting excited about is the prospect of pelvic PT becoming kind of part of our standard of care. Mm-hmm. I think now I see folks coming in just like, hey, I don't think I have any pelvic floor issues, but I just want to get checked out. How's my pelvic floor muscle strength? I'm maybe planning to conceive in a year or two. Is there anything I can do to prepare for that? Or, I don't have children, but I'm going to be heading into menopause soon. How can I proactively work on my pelvic health? Almost like you're going to the dentist and you just go in for a checkup and they tell you, oh, things are looking great, keep up the great work. Or actually, there's a couple of issues we want to work on to keep things really healthy. So that's the vision and the dream I have for this specialty. But I think right now it's mostly when people come in for certain type of bowel or bladder, sexual health or pain issues.
I love the idea though that that things are starting to change, right? And just thinking about how can you prepare your pelvic floor for whatever is happening in your life makes total sense. For those people that have never had pelvic floor therapy before, what should somebody expect in an initial consultation? Because I think sometimes people might be interested in exploring their pelvic health, right, but kind of holding back. So like, well, don't know what's going to happen. So
right, and it's so mystical. It's so mystical exactly. Because I feel like we're like, what is the pelvic floor? So it might be helpful to even just go over what is the pelvic floor if you're not super familiar with it.
Yeah.
So we all know the pelvis is kind of this ring of bones. If you see a skeleton, we know what that pelvis looks like at the base of the spine. But at the very bottom of those ring of bones is a basket of muscles. And they kind of sit like a hammock, and they attach from the pubic bone to the tailbone or sacrum in the back, and then side to side. So that hammock supports your pelvic organ. So in female bodies, it has the uterus, the ovaries, the rectum, which holds poop, the bladder, which holds urine, and they all kind of rest inside of that hammock. In male bodies, you have the prostate as well, and not the uterus or ovaries. But then inside of that muscle, we have openings. So we have the opening for the urinary sphincter, the anal sphincter, and then the vaginal opening. So all of these muscles kind of work together to help keep in pee and poop throughout the day until it's an appropriate time to empty, to relax during intercourse or a pelvic exam or tampon insertion, and then to contract to kind of hold in pee and poop, and then support our pelvic organs throughout the day. Mm-hmm. When we start seeing issues with these muscles is typically when, again, you start having urinary leakage or some maybe burning with urination or frequent urinary tract infections or constipation or painful sex. And when you come in to see a physical therapist that specializes specifically in the pelvic floor, that therapist should really have specialized training. I have a doctorate degree in PT, but I went on to get a board certification specifically in pelvic health, where we take specialized courses to be able to do internal vaginal and rectal assessments of these muscles. Because that's how we access them, is through the vagina and the anus. But a typical session is somewhere between 45 to 60 minutes. And you first just sit down, chat with your provider in a private treatment room. So you're not in kind of a big open gym clinic. Mm-hmm. And you just start talking about like, hey, this is what I'm here for. And the therapist will typically ask you more detailed questions about all of the systems in the pelvic region. So even if you're there for, say, constipation or hemorrhoids, we're going to ask you about your bladder habits, your childbirth history, your exercise routine, just to get a whole picture of like, is there anything else we need to address? And then we do an external assessment, looking at your abdominal wall, your low back and buttocks, your pelvic alignment, and all of that can be done with your clothes on.
Mm-hmm.
And then we typically step out and have the client or the patient change. And so in order to do the pelvic assessment, you just have to be undressed from the waist down. So then they lie on like a comfortable mat covered with a sheet. And then the therapist comes in to assess their pelvic floor muscles again through the vagina or the anal opening. So we insert a glove lubricated finger, just like maybe your gynecologist does, and ask you to squeeze around our finger. That's how we test a Kegel contraction, or what we're familiar with for strengthening. And then we'll also press on the side walls of the vagina, which is where the muscle is, to look for tension, tenderness, and then also weakness or prolapse. And then from that, we can determine, okay, does this person need strengthening, or does this person maybe have tension and then they need to work more on relaxation?
Yeah. And this doesn't, hurt. I think sometimes maybe people might worry that there's going to be discomfort, but for the most part, I mean, I've had pelvic floor therapy, like it doesn't hurt. It's not.
It shouldn't really hurt. And if it does, I mean, this is really open communication with your provider. This is nothing that, like, you are the driver of your healthcare. I firmly believe that. And you should be giving consent the entire way before you even get undressed. They should explain the exam to you, and you say, okay, I feel comfortable with that. When they come back in, they should say, I'm going to pull the sheet back. This is what we're going to do. If you have pain, we can stop at any time. But pain is also information for us.
Sure. Yeah.
It lets us know if there is an issue, kind of like if you have low back pain, we're like, okay, let me kind of look a little bit deeper to see what's going on.
Yeah, that totally makes sense. And if for some reason, you don't feel comfortable having the internal part of the exam, what do you suggest for people who are feeling like that?
There's so much we can do with just an external assessment. I mean, I really think of the pelvic region like an onion. And so you can really do so much with just working on those outside layers of the onion and kind of peeling the layers from the outside in. And I typically work with patients over several sessions just doing external work. It could take a really long time, or maybe never, to do internal work if they're not comfortable with that. So there's a lot of work to do on the abdominal wall, the back, the buttocks, the inner thighs, things that really, again, if you have all of this tension or weakness externally, that affects those inside muscles. So it's kind of one part of the body, but we really look at the whole region.
Yeah. Okay, that's great to know. You've written about pelvic floor tension quite a bit. Can you explain, exactly what that is and why it's important to address?
Absolutely. So I think the narrative around the pelvic floor has been that it has to be tight and it's got to be strong and do your Kegels. And, if you grew up in the 90s, like I did, it was every magazine was like, do your Kegels for better sex.
Totally.
And it's really not the case. I think more folks really walk around with tension in their bodies than we realize. Think about if you have a tight neck and shoulder muscle, and it kind of makes you kind of rub your shoulders a little bit. It could lead to headaches or back pain. It's the same thing, but this tension is held in your pelvic floor muscles. So just like we know your bicep, you can kind of, bend your elbow and shorten your bicep, and that's a tight muscle, or you can lengthen it, and that's kind of a nice relaxed bicep muscle. Your pelvic floor is a muscle, and it does the same thing. So if you have pelvic floor tension, some of the things we often see are difficulty starting your urine stream, incomplete bladder emptying, straining with bowel movements or painful bowel movements, hemorrhoids and fissures, pelvic pain, so tailbone pain with sitting, painful intercourse, pain with orgasms, and then, even prolapse. We think of prolapse as a weakness issue, which is when the organs aren't as well supported, but oftentimes people are tightening a lot when they have prolapse because they want to try to hold everything in. And so we need to work on the tension piece first. So I think it's really important to get a one-on-one assessment, or at least know which direction you need to go. And that will help determine, do I need to address the tension first, versus you go off and do a bunch of Kegels, and that could make your tension worse, and then your condition also.
Right. Yeah, I was going to ask, like, would Kegels potentially make that worse? And what would be a cause of pelvic floor tension, or are there many different
There's
ones?
so many. I mean, I think if I think about our day-to-day life, we're stressed out folks who sit a lot, probably don't move enough.
Yeah.
And I carry a lot of stress in my neck and shoulders, and I get headaches. This is the same thing for your pelvic floor. I think another thing is we've always been told, like, pull your belly button in and suck your tummy in and hold everything tight. Well, that doesn't necessarily make everything strong. It just makes it tight. So we really want to relax, work on kind of, you know, bigger diaphragmatic breaths or belly breaths, softening and relaxing into our body. We also do a lot of exercise. It's like tightening exercises like Pilates and, you know, CrossFit or bar exercises, and all that's tightening, but it's not working on rebalancing and relaxing afterwards.
Yeah.
So it's all about balance. And then of course, trauma, a fall, stress, birth, all of these things can create tension in part of your body.
Yeah. Yeah. And, you know, you mentioned Kegels earlier. What's your sort of general view on Kegels? I feel like it can be quite a divisive thing for a lot of people.
I know.
Where do you stand?
And I think with Kegels, it was like everybody should do them, to the other end of the spectrum was nobody should do them. But I really think that they're just an exercise. It's just like doing an abdominal crunch. They're not bad, but are there other ways to strengthen? For sure. Are they for everybody? Absolutely not. So they're not terrible, but they need to be for the right person. And then I think that, you know, if you're a tension person, they're not for you. Mm-hmm. But if you do have weakness and they're appropriate, it's important you know how to do them correctly. You do them in different positions. So you don't just do them sitting in the carpool lane or, you know, lying in bed at night. You want to do Kegels in different positions because you likely leak when you're in standing or when you're walking to the bathroom. You want to work the muscle in the position you need it to work. And then also integrating it into your day-to-day activities, like, you know, getting out of a chair, bending over to pick up a box or a piece of luggage, picking up your kiddo, you know, into your fitness routines. You can't just do Kegels and then do nothing else throughout the day to reinforce that that engagement. Right.
And potentially just building it into the habits of your life, right?
100%. Just like we think about, we brush and floss our teeth every day. We have to do a little bit of maintenance to just keep everything healthy.
Yeah, that totally makes sense. Well, vaginal dryness is something else that women, you know, often deal with, especially as we get into perimenopause and menopause. What's your advice for somebody who's, you know, dealing with dryness? And is it something that pelvic floor therapy can help with, or other methods that you would suggest?
Absolutely. And I think that this is much more common, so I'm so glad that we're bringing it up. We often see vaginal dryness when there's a change in hormone. So that can actually happen when someone is taking hormonal birth control that has estrogen. That means that our estrogen receptors in our body are getting this synthetic estrogen and it's kind of creating its own estrogen, and that can lead to dryness. So we see that in young women a lot. Postpartum moms, if they're breastfeeding or lactating and their period hasn't returned, also low estrogen can cause dryness. And then again, getting into perimenopause and menopause. All of these seasons of life, when estrogen is lower, contributes to the vaginal tissues and vulvar tissues getting thinner, drier, a little more fragile, because estrogen helps plump those tissues up. So when we don't have as much estrogen, it does kind of just get a little bit more frail and atrophied. So I really recommend using a daily moisturizer that's all natural. So it can be coconut oil, it can be vitamin E or vitamin E suppositories. There are tons of over-the-counter and online options, but I really recommend something that is based on something that's mostly natural, just minimal chemicals, paraben-free, glycerin-free, phthalate-free. This is a sensitive part of our body. We want to make sure that we're putting as clean of ingredients as we can. So that's one thing you can do every day.
And are you talking about like putting it on like your vulva, not necessarily
on the vulva, you know, so kind of on the labia, and then actually at the base of, you know, kind of on the inside of the vaginal opening as well, because we'll typically have a lot of dryness there. It's all what we call mucosal tissue. So think of like the inside of your mouth is kind of moist and soft. That's the same type of tissue that's on the inside of the vagina. And you know, when you get dehydrated and you're kind of like a little bit parched and you're smacking your lips and it feels dry, that's the same thing that can happen on the inside of your vagina and vulva. So you can put it on the labia. You can put it on the inside of the vaginal opening. Some of them are indicated for outside or inside. But then I also encourage using a lubricant during intercourse. I mean, that's something that will just minimize friction, increase comfort. You can experience tearing or a little bit of bleeding if you have thin tissue. So, you know, maximizing the moisture in the area is really optimal.
Yeah. Okay, that's great. Thank you. Well, we're recording in November, which is Bladder Health Month, and you've got some strong views on peeing. So what's your advice on, you know, a proper way to pee, and what are your thoughts on power peeing and why that's maybe not such a good idea?
Right. I've never thought about that. I have strong views on peeing, but you know, I really do. And I think it's because nobody teaches us how to do it properly. And, you know, with kiddos, I'm thinking about how am I teaching them? And then this is really good because I can teach them so that they know the proper way.
Yeah.
So if we're talking about a female body owner, you know, I really encourage folks to sit down. So instead of hovering over a toilet or squatting over a toilet to pee, if it's a decent toilet that you can sit down and kind of relax instead of standing or hovering. The other thing is to not push when you pee, which I call power peeing. I think as moms and, you know, busy women, we're notorious for trying to get out of the bathroom as quickly as possible. But when you push to pee, you are lengthening and weakening your pelvic floor over time. Really, all you need to do is just sit down and take a couple deep breaths and relax. Your bladder is a muscle that actually pushes the urine out for you if you just relax. But if you're pushing, it's just putting more pressure on your pelvic floor than what's necessary. So sit, breathe, chill, take a couple deep breaths and just let your bladder empty. You don't have to push out a little bit at the end. And then I really encourage folks to only go to the bathroom when they have the urge to go. I think as busy folks, we're like, every time we pass a bathroom, we're like, well, let me go just in case, or I don't really have to go, but we're about to go this place and I don't want to go when we get there. So let me go just in case.
Yeah.
That really trains our bladder to have to go more frequently. And then before you know it, we have to go every 30 minutes or an hour. So what's normal is 2 to 4 hours. What's normal is 2 to 4 hours during the day. And that should be your goal to empty.
I didn't know that you could actually sort of train your bladder to want to pee more just by doing that.
Right. It's really, and I think it's so common. People see that a lot, that they kind of start doing it maybe when they're pregnant because they have to pee all the time and they just never lose the habit. And then it's just their new habit.
Yeah. Yeah. Okay. What are your views on peeing after sex? Because I've heard that, you know, it's recommended for prevention of UTIs. You know, where do you stand on that? Do you think it's important to do it before and after, or what's the kind of ideal situation?
I mean, there are some instances where peeing just in case is okay. And I think before and after intercourse is one of those times. Before intercourse is not necessary, but if you just want to be a little bit more comfortable, make sure that your bladder's empty, that's totally fine. But again, don't push it out. Just sit, take a couple breaths. If something comes out, great. If it doesn't, walk away. After having intercourse, I do encourage trying to eliminate empty your bladder a little bit if you can. So your bladder is constantly filling with urine. It's never completely empty, but you have a short urethra. And if there is bacteria that can kind of creep up into that urinary tract, it does put you at risk for an infection. Not everybody has to do this, but if you know you're an individual that is at high risk for infections or gets them frequently, I would either get into the shower or just sit on the toilet, take a couple big deep breaths and just see, even if you just get a couple drops out by relaxing, that's totally great and totally fine.
Okay. If somebody's experiencing pain, you know, during sex, why might that be, and what should they do about it? I know you mentioned pelvic floor, you know, tension kind of being leading to that, but you know, I think that's something that a lot of people, you know, deal with often, you know, without, you know, talking about it to others. So what's your thoughts?
Well, pain is information about our bodies, right? And so I don't think we should ignore it. I think if we often have it in other parts of our body, we tend to give it more attention, but for this part of our body, we kind of just wish it away, which it doesn't necessarily happen. And it's an intimate issue to have. And I don't think we even know where to go to get help for it sometimes. Yeah. But typically some of the reasons for pain with intercourse, we mentioned one, vaginal dryness. Other ones are muscle tension. If you have tight, tense muscles, that may lead to pain with initial insertion into the vagina or deeper insertion into the vagina. It can lead to pain with orgasms as well. Other things are scar tissue. If you've had a vaginal birth where you had a perineal tear, which many folks do, or an episiotomy, some of that scar tissue can cause pain, or even a cesarean section scar. I mean, your abdominals are so closely connected to your pelvis that even the tension at the cesarean scar can actually cause painful intercourse as well. So, you know, the research shows that 1 in 4 women will experience pelvic pain or painful intercourse at some point in their life. And that's a pretty high number. And so I think it's something, again, more people experience it than we realize, but muscle, scar tissue, hormones, there are some dermatological diseases that can also cause it. But again, it really should be attended to, and, you know, see a pelvic PT or a specialist to get it evaluated.
Yeah. And what would be what would you do in pelvic floor therapy to kind of help with that?
So we talked a little bit about what we do in our exams, and our treatment is not dissimilar. If it's a tension issue, it's almost like massage, but we do a lot of that on the abdominal wall. So if you've got these tight, tender trigger points, you've got a cesarean scar, hysterectomy scar that's really restricted, we'll kind of do a little bit of scar massage over the area. If you've got really tight glutes, we'll go over some stretches to do, maybe do some massage and trigger point work to your glutes and even your inner thigh muscles. For the pelvic floor muscle specifically, we do internal trigger point or tender point releases. So it's inserting a glove lubricated finger into the vagina. The patient's lying down on their back, they're covered by the sheet, and we just go and find those tender spots and then put a little bit of pressure on it, just like you would put pressure on a knot in your shoulder. And then we just hold that pressure to bring some blood flow. They breathe and soften, and that helps relax the muscles. And then we teach them breathing and stretching, kind of different modifications to do at home to maintain some of that relaxation as well.
Yeah. Okay. Well, let's talk about childbirth. So are there any pregnancy or birthing strategies that you'd recommend, to people in terms of just, taking care of their pelvic floor, leading up into birth?
One of the things I really try to inform people of, and it's hard because I don't want to scare people and be like, your vagina's screwed, it's not at all. I mean, I think one of the things that really motivated me to start educating people in the space is I had great births and a great postpartum experience. And I was like, I feel like more people should know that this is possible if you know kind of how to take care of yourself. So some of the things are, work with a pelvic PT during pregnancy. You don't have to wait until afterwards. For constipation, hemorrhoids, prolapse or pressure, urinary leakage, abdominal separation, or what we call diastasis recti. And then even specifically to prepare for birth, to teach yourself how to push if you're planning for a vaginal birth, or, stretches and exercises to do after baby's born for a cesarean birth. So there's so much you can do to prepare, to really get your body ready for that childbirth experience, to have your partner be involved and they can come to sessions to kind of know how to support you during labor and delivery. And then even on the postpartum side to get some of that early education. So I encourage folks to work with a PT during, and then definitely to check in with one between 4 to 6 weeks postpartum for an in-person session.
Yeah. I really like that because we talk a lot at Nyssa about the importance of having pelvic floor therapy, after you give birth. Feel really strongly about that. But you make such a good point that actually it's so helpful to have beforehand too, not only for the practical physical reasons that you've said, but also to start to build up that relationship, right? Because it can be hard. You've just had a baby and then you go and do something maybe that you haven't done before. And it's a lot, isn't it? But whereas if you sort of establish that relationship with your pelvic floor therapist beforehand as well, it can just guide you through that whole time.
Absolutely. And I say that pregnancy and birth, it's like running a marathon with a full sprint at the end. We don't just go into that experience without training. Yeah. And again, I think the narrative has always been like, oh, you're pregnant, back pain's normal, or sciatica, or pubic bone pain. Now you just kind of have to deal with it. And that's not the case. There's so much we can do to make this a more comfortable experience for people. And I also think it's just not realistic. I mean, we have jobs we need to do. We have children we want to take care of, and exercise. They say, oh, exercise for your mental health. But if you're in pain, you can't do that. Or if you're leaking, it may not be possible. So I really think there's more to do that we can do to kind of lift this community of pregnant and postpartum moms up to really make it a much more kind of informed and less intense experience than it needs to be.
Yes, that's a really great point. And you've said before that postpartum is not 12 weeks, right? It's forever in some cases. So like, what do you mean by that? And especially when it comes to the impact on our pelvic floor after giving birth.
And I think it's the impact on our pelvic floor, and I think it's just to us as humans. I mean, I think you can attest, Mia, that once you have a kid, it's just a different situation on the other side. And again, it's a huge transformation for your body. And I think that people think like, oh, I've never had kids. Maybe I don't have a pelvic floor issue. You can have a pelvic floor issue at any season of life, but pregnancy and birth are probably one of the biggest transformations you'll go through. So, what I do say about the 12 weeks is I think that people think like, oh, I only need to take time for recovery during 12 weeks, or after 12 weeks, like I'm totally fine again from a physical perspective. And that's just not the case. I don't want it to say like, oh, your body's doomed. And, it's not. I think it's actually a really beautiful transition that we make. We just don't know how to transition back into it. We get a thumbs up to have sex, and we get a prescription for birth control, and we say, okay, go back to exercising. But again, your body's been through so much, you need to work back towards what it can do. You can't just go back to the same fitness routines. So I really say that so that if you're having issues at 3 months postpartum, check in with a pelvic floor PT. The research shows that you may still be experiencing issues at 1 year postpartum if you don't get them fixed. Leakage, painful intercourse. So be attentive to that. The other is, I think, give yourself some grace. I still think we have so much pressure to go back to what we used to be able to do or what our bodies used to look like, but it takes so much time, and 12 weeks is just a sliver of time in the big picture. So give yourself grace and time to really recover and take your time and ease back into things and not put so much pressure on yourself, especially from a physical perspective.
Yeah. I love that. How's the post-birth impact on one's pelvic floor? Like, is it the same or different depending on whether you've had a vaginal or cesarean delivery, and how so is it different?
I say this, that a vaginal birth isn't necessarily going to ruin your vagina, but a cesarean birth isn't necessarily going to save it either. I know. Yeah. What I mean by that is that your pelvic floor goes through changes just during pregnancy itself. We talked about this hammock kind of supporting your pelvic organs. Well, we get these, email messages or text messages that say your baby's this many weeks, it's the size of an avocado, then it's the size of a papaya, then it's the size of a watermelon. Well, imagine a hammock supporting an avocado. There's not going to be that much change. But if it's supporting a watermelon, that hammock's going to sink a little bit lower, get a little bit more stretched out. And that's really what happens to your pelvic floor just during pregnancy itself. Afterwards, there is research to show that having a vaginal birth can put you at a higher risk of having urinary incontinence or pelvic organ prolapse. So if you do have concerns about that, I always recommend talking with your healthcare provider, your physical therapist, about ways that you can kind of minimize that risk if you do want to have a vaginal birth. But also with a cesarean birth, there's it's an abdominal surgery, and that's, a major recovery process. And research shows that people who have a cesarean birth may experience more pain with intercourse because of the tension or the tightness. So there's no one answer for everyone, but both impact you in different ways. And I really think it's up to you and your medical provider as to what the best option is and the safest option for you.
Yeah. But both can benefit from both can benefit from pelvic floor therapy afterwards.
Totally. Both can benefit. And I think that that's one kind of myth too, is that I had a C-section, I don't need to go see a PT. But again, pregnancy changes your pelvic floor. And especially after a C-section, there's so much we need to do to rehab your abdominal wall and work on your scar, that there's definitely work to be done.
Yeah. Okay, could you just walk through a couple of strategies for that dreaded first postpartum poop for anyone that's listening who's currently preparing to give birth? Just give them some
Absolutely.
tips.
I just did a reel on this, and it was getting a lot of views, and I was like, okay, this is what people need to know.
The people need to know.
I know. So, one of the first things is the first poop after birth sometimes can be really difficult, and it's not often talked about. So I encourage people to take stool softeners starting day one. So whether you're at home, whether you're in the hospital or birthing center, start taking stool softeners and hydrate. You've lost blood, you're creating breast milk, and that takes a lot of fluid from your body. So make sure that you're really hydrating. You're often on pain medication that often can be constipating. So stool softeners, hydration, movement. Get up and out of bed walking on the first day. Whether you have a C-section or a vaginal birth, you need to be just walking the hallway, getting things moving. That helps. And then the biggest thing is, getting what we call a squatty potty or a poop stool. It's a little stool that you put under your feet. It can be your luggage, your suitcase if you're in the hospital, or a sideways trash can. It can be like a special poop stool or your toddler stool if you're home. And you want to put your feet on that so that it kind of lifts your knees and up above your hip level. And that puts you in a bit more of a squatting position. And that helps relax your pelvic floor. And then if you've had a vaginal birth, I tell people to take a piece of toilet paper. So pee first, take a piece of toilet paper, and then hold up the vagina when you're pooping. So you can kind of hold up the vagina, exhale. So you don't want to hold your breath, exhale and kind of bear down to poop. Holding up the vagina kind of supports the tissues that are already vulnerable, or if you have stitches.
Yeah.
If you've had a cesarean birth, and you want to take a pillow, put that pillow over your tummy, exhale and bear down. Your feet are still in the stool, and kind of that will help with bowel movement. So supporting, your abs or your pelvic floor, not holding your breath. So exhaling like you're blowing out a bunch of birthday candles, and lots of hydration and stool softeners.
That's really great. And I think just taking it like very slow, right?
Taking
like,
it slowly.
This is not the time to like.
No, you don't need to shoot anything out. I mean, everything's vulnerable. And so take it slow. It literally can feel like you're pooping a baseball. So like take your time with it, elevate your feet, whatever you need to do, but take your time and definitely kind of support those vulnerable areas.
Yeah. That's great. And what would you say, like what role can the application of ice and heat play postpartum, do you think, just, when it comes to just recovery and healing?
Absolutely. So if we think about, we use ice all of the time. If our kiddos have a bobo, or if we are after a surgery, we put ice initially the first couple days. So I really encourage ice for the first 2 to 3 days. And there's a lot of inflammation and swelling in the area. Mm-hmm. You can put it over your abdominal incision. You can put it over the vulva or vaginal region, and you want to leave it on for about 20 minutes. So just enough to kind of numb the area, slow down some of the circulation, and then you take it off, and then more blood flow can come to the area, and then you can put it back on for another 20 or 30 minutes. So like 30 minutes on, 30 minutes off, several times a day for the first 2 to 3 days. After that, heat can be really comforting. I think a lot of people have said that putting a heating pad over their belly after a C-section was important, or sitting in a warm sitz bath if they had a perineal tear was really soothing, or if they had hemorrhoids. So, but I do encourage more ice in the first several days of healing, and then after that, transitioning into heat.
Yeah. Okay, so we talked about diastasis recti. That's the right way to say it, right? The last time that you were on the podcast for season 1, but it's still something that people don't really, know that much about, or if they don't have it, they don't know that if they do have it, they don't know that it is possible to work on healing it, 6 months down the line, a year down the line, whatever, like, right? You can always address that. So could you just explain, what it is and your perspective on, how people might be able to treat it postpartum or prevent it? And you can't really prevent it, right? But like, just help, during pregnancy to kind of care for that.
So it typically pops up during pregnancy. You'll see it if you're like, laying in bed and getting up, or if you're getting out of a chair or couch and it looks like a little football in the midline of your belly, or like a little alien popping out. And then it doesn't necessarily go away postpartum. The reason it happens is because you have a little line of tissue between your 6-pack abs called your linea alba. And, we have that tissue there so their abs can stretch and expand, which is what we want them to do during pregnancy. So that tissue just gets really thin. And if you have a lot of pressure from, doing a crunch up to get out of bed, or weightlifting, or doing abdominal exercises, it actually kind of just puts too much pressure on that tissue. So postpartum, what I tell people to do is kind of lie flat on their back, their legs are straight, and just lift their head and shoulders off the table or off the ground. And if they can kind of press their fingers deep between their abdominal muscles, above the belly button, at the belly button, and below the belly button, if it kind of feels like it's not like a trampoline there, they could have a diastasis. So again, you can do an online program, you can work with a PT, but retraining and strengthening that will help with back pain, with prolapse, with pelvic floor issues as well. So you want to make sure that you're doing things to avoid making that worse, but also doing exercises to help make it better as well.
And if you do have that, does it make you more susceptible to having prolapse like down the line, or are they sort of separate?
It's almost a similar issue, just in a different part of the body. So we think about weak and lengthened tissues with too much pressure. So I wouldn't say that it's contributing to it, but the things that cause those two issues are similar. Straining, overloading the tissues, holding your breath a lot, like doing what we call a Valsalva, which is holding your breath when you're pushing or straining, which is often what we do during childbirth, which could also contribute to those. So it's a great question. It's a similar pattern that can contribute to it, but one necessarily doesn't cause the other.
Yeah. Okay, got it. Well, finally, last question. It seems to me that pelvic floor therapy, is really finally having a moment, right? You're saying, like, even, in your practice, people are coming in, as they might, be going to the dentist, right, as part of their sort of overall wellness care. So how are you seeing your industry sort of evolve, and what would you like to see change, like in the next, sort of 2 to 5 years? What big dreams would you have for your
Yeah, it's been exciting. I mean, I started this just on Instagram 5 years ago, and I grew from 500 followers to almost 500,000 followers. And I think it's insane to me. Yeah. And I never set out to be an influencer. I was just kind of a nerdy PT who wanted to share a lot of pelvic floor tips with my girlfriends, as we're all having babies. But I think that the growth is really a testament to people wanting this information, people saying, why am I not getting this information sooner? Or I wish I would have known this sooner. And, they want to be proactive in their pelvic floor health. And so I think it's just awesome. I think it's really helping integrate pelvic floor therapy into the healthcare system. I still think that, at least here in the United States, they could do a better job of covering wellness and prevention for physical therapy for the pelvic floor. Right now, you can kind of only get it covered if you have an issue. But I think it would be great to have people automatically go in during pregnancy, automatically go in during postpartum or menopause, or when they become sexually active. So my hope is that it becomes more ingrained into our healthcare system, that physicians, midwives, nurse practitioners know when to refer. I think patients are still having to go in and say, hey, can I go see a PT? I heard about this thing. I think those medical professionals could really start referring more proactively, instead of telling patients, oh, give it time, or, just do these exercises from this brochure and see what happens. I think that they could start integrating us into the process more. And then I think that the outcomes have a lot of potential. I do all of this research and to kind of see what the stats are. And it's 65% of, 50% of women over the age of 65 have urinary leakage. And I'm going, I don't want that to be my destiny. Like, what can we do to make that better? What can we do to reduce that? So I really hope that, I loved when I heard you say, like, we're having a moment, and I feel like it is a movement. And I just really hope I continue to see it grow by, being able to chat with folks like you who are sharing this information with your community.
Yeah. Guess what? I very much hope the same. Where can people find you? And also mention your new guide as well.
Oh yeah. So if you're on Instagram, I'm the.vagina.whisperer on Instagram. And I just share a ton of tips and probably too much information on there, but it can be entertaining to watch.
Yeah, definitely.
And then my website is thevaginawhisperer.com, where I have a membership platform of pelvic floor exercises for pregnancy, postpartum, strengthening, painful sex, for folks who can't access a PT in their town, or maybe, they need a more affordable option. It's a great way to kind of access exercises and start working on some things at home. And then I do have a free guide that I love for people to download, just to start getting some of these kind of quick tips, like about how to pee or poop properly. And it's on my website as well. If you go on there, it'll pop up and you'll be able to sign up for it.
Perfect. Thank you. Thank you for all the work that you do, because I have learned so much just following on Instagram and, being in touch over these last couple of years.